If you feel itchy, sore, or irritated down there, it's so tempting to assume it must be thrush and just grab a treatment. But here's the problem. A lot of women treat thrush when it isn't thrush, and then the symptoms drag on for weeks. In this video, I'll help you recognize thrush more accurately and know when it's time to get checked. And if our bacterial vaginosis video left you thinking, okay, but what about itching? This is the natural follow-on. Vaginal thrush, also called a yeast infection, is very common and it can be miserable, but it's also commonly confused with other causes of itching and irritation, like BV, allergic reactions, dermatitis, or STIs. So today we're going to cover what thrush actually is, the classic symptoms, what makes thrush less likely, how thrush differs from BV and STIs, what the NHS recommends for treatment, what to do if it keeps coming back, and the red flags that mean you should get checked urgently. And just to be clear, this is general information, not personal medical advice. If you're worried, it's always okay to ask for an exam or a swab. You're not being dramatic, you're being sensible. Vaginal thrush is usually caused by an overgrowth of a yeast called Candida, most often Candida albicans. Small amounts of Candida can live in the body normally without causing problems. Thrush happens when the balance shifts and Candida multiplies, irritating the vulva and the vagina. Here's the key idea. Thrush isn't about being unclean, it's about a change in your internal environment. Thrush has a really recognizable pattern for many women. Common symptoms include intense itching around the vulva and/or inside the vagina, soreness, stinging, or burning, especially when you wee, if urine touches irritated skin, redness, swelling, and irritation of the vulva, thick, white discharge that can look like cottage cheese, and pain during sex due to irritation and inflammation. A lot of women describe it as feeling raw, itchy, inflamed, and so uncomfortable that sitting, walking, or sleeping properly becomes difficult. This is where many women lose weeks, treating thrush again and again when the symptoms don't actually fit. Thrush is less likely if the main symptom is a strong, fishy smell. That's more typical of bacterial vaginosis. It's also less likely if your discharge is thin, watery, or greyish, rather than thick and white. If you've got pelvic pain, fever, or you feel unwell, think beyond thrush. If you've got bleeding after sex or bleeding that's unusual for you, don't just self-treat. If symptoms started after a new sexual partner and you've got pain passing urine or unusual discharge, it's time to get checked for STIs. And if the itching started after using a new product, like a scented wash, wipes, pads, lubricant, or condoms, it could be irritation or an allergy. Also, if you've had 2 or more thrush treatments and it isn't improving, the plan shouldn't be more and more treatments. The plan should be to confirm the diagnosis. Here's a simple comparison. Thrush usually means itch, soreness, redness, plus thick white discharge. The smell usually isn't fishy. BV usually means a fishy smell plus thin or watery grey discharge. Itching can happen, but it's often not the main feature. STIs can cause discharge changes, bleeding after sex, pelvic pain, or burning when you wee. And sometimes there are no symptoms at all. You can't reliably diagnose this by guessing. If it's new, persistent, or recurring, testing can save you time and a lot of stress. Thrush can be triggered by antibiotics because they can reduce protective bacteria and allow yeast to overgrow. It can also be triggered by pregnancy, diabetes, especially if blood sugars aren't well controlled, changes in the immune system, hormonal changes for some women, and irritation from products that disrupt the vulval skin barrier. And sometimes there's no obvious trigger. That doesn't mean you've done something wrong. While you're arranging treatment or waiting for symptoms to settle, a few supportive steps can make a big difference. Keep the area cool and dry. Wear loose, breathable cotton underwear. Avoid tight leggings for a few days if you can. Wash externally with plain water or use a gentle, non-fragranced emollient cleanser externally only. No internal washing. Avoid scented products, douches, and so-called feminine hygiene washes. And if sex is painful, pause until you're comfortable. Pain is your body's signal to stop and let the inflammation settle. The goal is to reduce irritation so the skin can heal. NHS treatment for thrush typically involves antifungal medicines such as clotrimazole as a pessary or cream or fluconazole as an oral capsule in appropriate cases. Some people can buy thrush treatment over the counter, and if the symptoms are straightforward and familiar, that can be reasonable. But if this is your first episode, it's not improving. It keeps coming back, you're pregnant, you have diabetes, or you're immunocompromised, it's safer to get medical advice and confirm what's going on. Also, if you use a treatment and it burns badly, stop and get advice. Severe burning can be a sign the tissue is very inflamed or that the diagnosis may be wrong. Consider getting checked by a GP or a sexual health clinic if it's your first time with these symptoms. The symptoms are severe, the symptoms keep coming back. You've treated twice and it isn't improving. You're pregnant, you have pelvic pain, fever, or you feel unwell. Or you've got new sexual partner or partners and you want STI testing for reassurance. In the UK, sexual health services are confidential and they can often assess you quickly. If thrush keeps returning, say 4 or more times a year, you deserve a longer-term approach, not repeated guesswork. Ask your clinician, can we confirm this is thrush with a swab? You can also ask, is it Candida albicans or another type? Because treatment can differ. Ask, could there be a trigger like diabetes, antibiotics or irritation? And ask, do I need a longer course or a maintenance plan? Recurrent symptoms aren't a personal failure. They're a clinical pattern that needs a clinical plan. It's understandable to look for quick relief. But be cautious with anything you insert vaginally that hasn't been recommended by a clinician. Some home remedies can burn and make irritation worse, especially when the tissue is already inflamed. Your vagina doesn't need detoxing, it needs the right diagnosis and the right treatment. Thrush can be straightforward when it truly is thrush, but when symptoms don't match or they keep coming back, you deserve more than trial and error. You deserve confirmation, clarity, and a plan. And if you want an even easier way to recognize what's going on, learning the basics of discharge, color, and texture can help you spot changes early, because your body's always giving you information. If you're trying to figure out what's causing your symptoms, it helps to compare patterns. Itching and soreness often point one way, while odor and thinner discharge can point another. So tap the thumbnail on your screen now to watch our BV video, Bacterial Vaginosis, the Common Vaginal Imbalance. It'll take you straight there, and it'll help you recognize the differences more confidently.